you mentioned here in a second, like just kind of talking through hesitancy. What's your approach to some of that?
It's patient specific.
Yeah.
It's patient specific because everybody, you can do a study and decide what are, the top reasons for vaccine hesitancy. That's great. Like, we can all prepare for that. But I think when you really sit down and take the time to listen to a patient, and just, even if their fears are just completely irrational to you as a clinician, you're just like, how did you get here? Besides TikTok? Like, how did you get here? You have to listen, and you have to listen with you have to have listening eyes when you listen to them. Yeah. Like, not just waiting for them to stop talking so you can say the next thing that's going to debunk whatever they said.
Right.
Having that empathy, really thinking, wow, if I didn't know better than that, that would really prevent me from getting this vaccine or whatever. I think that's part of it, just really having those individual conversations and developing a relationship. I have had some patients that I could not get them there in the first conversation. But if you can leave them with something, think on this and come back. And, I don't know how many of those have actually come back, but I would say most of the time we do talk them into getting the vaccine, and it has to feel important to them, and whatever their hesitancy is, you have to acknowledge it and not treat them like a group of people who believe in this particular myth.
I gotcha. Yeah. You have a population there that's fairly unique too, right?
Yeah, we have we have a lot of the Latinx community in Springdale, but we also have a really high population of Pacific Islander people, and specifically Marshallese. And a lot of people go, "What did you say?"
We had that exact same.
We were talking about that before we got on with you, because what Madison,
do your homework?
No, Madison did homework with you, and then I did homework afterwards, and I was like, whoa, I didn't know there was that many Marshallese people there in Springdale.
Yeah, there's a lot. It's like the Northwest Arkansas has the largest population, if this is still correct.
It is correct
in the United States. And we do try. I have two employees who speak Marshallese, and it's different than Spanish. I can speak enough Spanish to get myself in trouble. I can listen and try to pick up on context clues, but Marshallese is just a very difficult language to learn. And so, I rely extreme amounts on my two staff members to help with that particular population. And vaccine hesitancy is a concern, but I would say the biggest concern when reaching that population is getting information to them in a timely manner that is in their preferred language.
Sure. Yeah. Okay.
You can go anywhere, like Google Translate doesn't have Marshallese. There's not there wasn't an EUA in fact sheet in Marshallese, and it's really tough. We have one physician here, primary care physician that I've worked with. He's one of two in the United States that are Marshallese physicians.
Wow.
And we're very fortunate to have him, and I've worked with him a lot, and we work together to try to reach that particular population. But I remember when the Pfizer got approved down to age 12.
Okay.
I was approached by a community member who's a big advocate for the Marshallese community, and he said, I want to have a back to school event for this group of people. And at that time, I can't remember exactly when Pfizer got the approval for down to age 12, but it had been a while.
Okay.
And I remember being like, wow, we're not any better at this than we were when COVID first came out, and COVID really wrecked their community. It impacted their community just significantly.
Okay.
And I thought, wow, and I said, why are we just now waiting? Like, why just now? It seems like we're a little delayed in this. And then I'm thinking, well, I should have done something
Right. Yeah.
better. And he goes, they didn't know that their kids were eligible. I'm being told by parents they didn't know. And I was like, wow, it has been all over the news, I mean, in Northwest Arkansas community, very for the most part, pretty vaccine friendly.
Yeah. Pretty high percentage of population, at least where you're at anyways.
Yeah. Fayetteville specifically. And it was just a wake up call to me. It's like, man, I've been embedded in this community for now 10 years. And, at what point are we going to start thinking about them first?
I see what you mean. And then to your point, like you said, now try to introduce an appointment-based model with, you know what I mean? You got a lot of barriers in front of that it doesn't lend itself to subjecting everybody to yet. Right. 'Cause it's just not there.
It kind of takes me back to when we talked to Rannon early on, and his pharmacy in Terrytown, they served a lot of disabled adults. So mental, they were in group homes and they were completely forgotten.
Yep.
And, we were like, man, we're doing such a good job patting ourselves on the back, vaccinating all over the place. And then there's these pockets who are just wholly forgotten. And that when they pop up, you're like, oh man.
Yeah. I mean, we went to a few places like that. We went to a low income senior citizen community, not assisted living. I don't really know exactly how to classify this particular group of individuals, but I remember when the property manager reached out, and it was like, oh my gosh, she was like, I will rent a bus and I will load them up and bring them to you if you will just vaccinate them. And I was like, completely unnecessary. I will come to you. I just didn't know you existed. So
right.
I will come to you, and me and 2 interns, and, we just went and took care of their community. And the reaction was just like, wow, y'all will come on site. And that's what I learned. I think looking back on the whole process, your pharmacy is so far beyond your 4 walls.
Mm-hmm.
If you can get out in the community and serve in those ways that no one else is, there's extreme value in that.
Yeah, that's big. It echoes too. And you ended up meeting people, like you said, that you didn't know, or people that you should know, right? And I know a lot of people come on here, all have relationships now with either some type of public health person, some type of FQHC that maybe, or some home or something like that they didn't used to talk to or didn't serve, and now they do.
Yeah. I mean, I remember Scott touched on our relationship. Scott Pace touched on our relationship with Dr. Dillahay with the Arkansas Department of Health. She's a lead epidemiologist, and she has been the biggest champion for pharmacy throughout this. And we have such a great relationship with the Department of Health through this. It just makes you go, okay, now we all need to get in a room and we need to say, what do we do well and what do we need to do differently next time? I think we all have a tendency to, not that COVID's over, COVID is not over,
right.
But when things start to settle down, you go, oh my gosh, I can take a breather. But really, before you do that, we should all get in a room and brainstorm on how could we have done this better? How do we reach the populations that it took so long to get to? And we're all guilty of it. We all need, everybody, I think, in healthcare is a little overworked and exhausted and, right now, but it would be good to do that.